Oh, perfect. Oh, thanks, Rose. Okay, welcome everybody to our first online meeting with ifmaKC during the global pandemic. And I want to welcome you all to our members and to our guests. I have no idea who all are on the meeting right now. I'd have to look at a list and who's a guest. So thank you all so much for taking time to come join us today for this meeting. And I want to thank our sponsors. As you can see the slideshow, and also to our new diamond sponsor, Hair and Laughlin Restoration. And we have a couple of campaigns that are going on, or one campaign in particular. I don't know if Jason's on the call. Jason Kaiser with Q4 Industries has reserved 1,000 masks for us for ifmaKC, and so far we have 235 masks raised. So if you are interested, every $10 purchases 25 masks at wholesale. You're not going to find that kind of price anywhere else. And what we're doing is we are donating the masks to hospitals and places that need them. So if you're interested in participating, ifmaKC wants to give back, and Jason is so gracious to offer them to us at wholesale, and that's what we're raising them as. So if you are interested in that, please contact me or Rose. Rose Parmeter-Albert is our admin, and she's the one who is helping facilitate this meeting. So thank you, Rose, as well. She does our Monday morning memos, and she gets us all ready for these meetings, and I really appreciate that. And then we also have something in the works around doing a IFMA facility management roundtable about going back to the office. So how was that going to look?
Mr. Cranky Butt.
Mr. Cranky.
Rose, you're not muted. So in the next week, be looking for a roundtable or discussion about facility managers and what they're doing to get back into work, from cleaning to, you know, procedures. So just kind of be on the lookout for that. And we would love to have you join IFMA if you're not a member, and we'd love to have you join a committee if you are a member and want to get more involved. The more you put in, the more you get out. And we're pretty cool, if we don't say so ourselves. And am I missing anything, Rose or Brittany? Before we introduce
I don't think so.
Did you thank all of our sponsors? It's great we have our new diamond sponsor, but we have lots of great sponsors.
Yeah. Rose, can you pause the... there. And I want to go ahead and give a special shout out to our sponsors, ServPro, Image Flooring, Bentley, Hallmark, Scott Rice, Office Works, and Herman Miller. Thank you all. Round of applause for everybody. And I know you guys are out there trying to keep everybody, your clients, customers, and the city afloat, as well as our chapter. So thank you. We really appreciate the support. And next, I'd like to introduce our speaker, Janet Lockridge. And Janet has spoken for us before. If you've been a part of IFMA for any length of time, you've heard from her. She is excellent in disaster recovery, business continuity, and emergency planning. And I'll let her go ahead and say a little bit about herself, and she's going to be our speaker today, so please help me welcome Janet Lockridge. And this is all new for us too, you guys, so we appreciate your patience as we get this all going.
Good morning, everyone. Have I shared my screen or?
Not yet.
Okay. I am on. Okay. I'm still learning this technology, so bear with me. Okay, so let me get back to, okay, so I'm sorry.
No, you're good.
It's, okay, so here we go here. We practiced this, I promise we did. Okay.
So you'll share screen.
I know, I'm trying to even get to it. Hang on, I'm so sorry.
No, you're good.
It's not,
More people are being added to the meeting.
okay.
Is that the one and only John Alexander?
It is, so you can see me?
We're in deep trouble when
Always works
Alexander's
when you're
supposed to help.
practicing.
Now we know we're in trouble. John Alexander is in the picture.
It always works perfectly when you practice, and then when you got people on, it doesn't work.
How do I do?
Yeah.
Okay, so I am, okay, so can you, I'm still having problems getting to my Zoom. What am I doing? Okay, now, here we go. Okay, why is it, okay, share.
There
Okay.
we go.
There we go. Okay, I apologize.
That's all right.
Okay, so, okay, now, well, good afternoon, everyone. I'm Janet Lockridge. Thanks for ifmaKC for allowing me to speak to you this afternoon about something near and dear to my heart, facility management, emergency preparedness, and safety all rolled together. I'd like to also thank my sponsor this afternoon, which is Property Track. John Alexander and John Massey, we work together on developing emergency preparedness modules for the Property Track. And I'm going to also show you a slide a little bit later about how we can use Property Track to manage infectious disease planning as we move forward. So just a little bit about myself. Well, first of all, this COVID-19 pandemic is something that, in my opinion, kind of caught us all off guard. I worked in emergency preparedness for years. We've talked a lot about tornadoes, hurricanes, and mass shootings, cyber attacks. But when I look through the literature, there's not a lot of information about pandemics and other infectious diseases. So, you know, in my opinion, the world has kind of been caught off guard, especially the United States, as far as our preparation was concerned. And a lot of our businesses, I believe, was also caught off guard. Our facility managers, from HR to finance, I believe that a lot of us was caught off guard with this. So what my goal is today is to give you some resources and some information that will help you manage where you are today, as well as give you some practical boots on the ground tips to help you as you recover and the building occupants and visitors return. Just a little bit about myself. I have worked in public health and community health for a number of years. I served as a facility director. I had responsibilities for the actual grounds, housekeeping, but Where my love for emergency preparedness came was just the fact that I was responsible for emergency preparedness and those types of things within my organization. I sat on the local LEPC, which is the local emergency planning committee, as well as attended several state conferences, as well as national conferences around preparedness. So I'd like to say that I do have a lot of respect and information out there given to us by our leadership as far as emergency preparedness is concerned. Recently, I have a company that I've started where we provide safety training. We focus a lot on the OSHA type trainings, fall protection, hazardous communication, PPE. So we'll do a lot of safety training. So really excited about that. I'm also an educator, so training and instruction is also a love of mine. So just wanted to give you a little bit about myself because I've actually been in your shoes as a facility director, so I know exactly the types of challenges and risk that you face within your organizations. Our agenda is going to be pretty straightforward. We're going to talk a little bit about the current situation. I would like to also go into some safety management. When we talk about the safety management, I'm going to get into some leadership opportunities that facility managers can take during this time. I think that right now is a really good time for us to brush up on our leadership skills. Some of us have been so working diligently to make sure all of our preventive maintenance is done, make sure that we're managing our suppliers and our vendors. But I think right now is a really good time for us to take a step back and look at how we can develop our leadership skills a little bit more, and actually look at developing our individuals, our folks that work for us when they come back to the workforce full time. We're going to talk a little bit about environmental stewardship, as well as some key actions that you can take now in order to prepare you for planning, risk management, as well as the return of occupants back into your building. So imagine, if you would, the Birds movie. Remember that movie, The Birds, that came back, I believe, I want to say it was either the 70s or 80s. I can't remember. I'm dating myself. But this particular movie, you know, we thought it was kind of far out then, but it really is not too far out. Just like this pandemic, you know, we really, you know, we've seen sci-fi movies. Just Sunday during our stay-at-home order, I have two teenagers, well, one teenager and one grown man now. And so we were sitting around watching The Matrix, and they were like, "Mom, haven't you seen this movie before?" And I was like, "No, I haven't, because I'm not a sci-fi girl. I'm not a big sci-fi girl." But when you think about some of the sci-fi movies that you've watched, some of that seems pretty far out, right? It seems kind of, you know, futuristic, and it just doesn't seem like it could happen. Much like this coronavirus, it seemed at the time futuristic. Many of our businesses and our business owners never imagined that we would actually close down the whole United States in order to self-quarantine and just for us to practice social distance. So what does that mean? You know, and when we're thinking about our risk, I want you to, throughout this presentation, to think about the unmanageable. Because I want you to be able to imagine the worst case scenario and then work your way back from there, and making sure that you develop your risk plans based on all of the what ifs that could occur. Have you thought about this? Is this a concern for you? I don't know if we've gotten into the habit as facility managers to look at the weather forecast. This is a huge risk. We have severe weather season upon us, and so it is a really good idea for us to take some time to look at the 3-month outlook for the temperature, look at the precipitation probability. I hear some feedback. Everything, okay. So look at the precipitation probability, because this could impact your business. This could impact how you manage your facilities. This could impact some of your outdoor plans and preventive maintenance. So you want to make sure that you take the time to look at probabilities as far as weather is concerned. What about any of these? We have we've talked a lot about cyber attacks. We've talked a lot about threats to us as far as terrorist attacks. We haven't talked a lot about earthquakes, but we are on the New Madrid fault line, and an earthquake is a true probability for us here in the Midwest. The earthquakes that have been occurring, we know in the last couple of years we've had some pretty sizable earthquakes, but we never know when that one major earthquake is going to hit, and it can impact us. Even an earthquake that hits in California could actually impact us here in the Midwest. So what would you do in order to mitigate some risk of some of these concerns? Last March 19th, there was a massive power grid outage in the southwestern United States. This particular power grid outage occurred over several days, but luckily they were able to get it up and running, and individuals were able to mitigate the damages that had occurred. But as a facility manager here working every day in Kansas City, what are you thinking about? Are you thinking about a power grid outage, and what would you do? We're talking about cyber attacks. The World Health Organization, they are an organization that many of us have heard about the last couple of weeks. They had a cyber attack a couple of weeks ago. And what they learned about the attackers were that the attackers have been planning this attack on the World Health Organization for a total of 9 months. Individuals are out there, they are planning attacks. They were just waiting for the right time to hit the World Health Organization. And COVID-19 presented an opportunity for them, as they thought, as being the right time to hit. So you want to make sure that you are trying to mitigate all of your risk. You want to look at all of your risk and position yourself to manage those should they occur. Has anyone ever said this in your office? It's never going to happen. That's what a lot of facility managers hear from their leadership. A lot of times, you know, even working with some of the more seasoned facility managers, they're like, oh, that's never going to happen. It's never happened in 30, 40 years. It's never going to happen. Well, oftentimes we don't think it's going to happen, but it does occur. And even though we've not seen it before, we got to use that what if scenario. Peter Sandman, who is a risk communications consultant, he's based out of Princeton, New Jersey, said that the problem is that people often either reduce their sense of the probability to 0, and they say that it's too unlikely to worry about it, or they actually inflate the possibility to the point where it is easy to keep on top of the list. And again, people just say that it's never going to happen, but we know that this particular virus has impacted us so tremendously that we didn't see it coming, and so we have to figure out how to prepare moving forward. What I'd like to do is to give you a historical perspective of the pandemic flu of 1918. Influenza pandemics typically occur every 10 to 50 years, according to WHO, which is the World Health Organization. It is difficult to predict how severe it will be, but the flu pandemic of 1819 was unusually strong, leading to about 40 million deaths worldwide, while the pandemic of 1957 and 1968 were responsible for about 2 million and 1 million deaths respectively. The 1918 influenza pandemic was the most severe pandemic in recent history. Again, we don't know. I would venture to say that perhaps the COVID-19 pandemic will probably be up there as well, if not the most severe pandemic. The numbers of death was estimated to be at least 50 million worldwide, and about 675,000 occurring here in the United States. I am going to attempt to show you this video, and if it does not work, we'll just get right back to the presentation, because again, you have to understand, and I apologize, I'm technology challenged. So let's just see if it will work. Can you hear it? Okay. Okay, that's not what I wanted to do. Okay, so so we can see here from these photos from workers that were in the 1918 influenza pandemic. We see a typist here wearing a mask that looks like today in our workplaces, as well as the policeman here. He is also protecting himself from the spread of the virus by wearing a mask. And we can see this throughout our city, our country today. That typewriter, it looks familiar. I wasn't around in 1918. However, I was able to use a typewriter. So for those millennials that aren't on the Zoom call, that is what a typewriter looks like, just to let you know. So anyway, the wearing a PPE for workers is nothing new. This has happened back in 1918 and will continue to do so today. The issue today is we have a lot of PPE to choose from. We have, however, the quantities are kind of drying up, but we have more advanced PPE, and so really excited about some of the other alternatives. Now, we do know that the N95s, which recommended, often those are all sold out. I get that information from my suppliers, but if you're needing masks, make sure that you're looking for other alternatives, because there are some other alternatives that are out there. The other issues around the messaging that was out in 1918 and 1919 was for PPE, but also for workers to wash their hands and to cover their cough, much like it is today. So the current state, I'm not going to spend a lot of time on the current state of the COVID-19. One thing I do know for sure is that there is an enormous amount of information that is provided from all levels of government, local government, so CDC, OSHA, a lot of information is out. So I am not going to go over some of the information that's already out there. My advice, though, would be for you to make sure that you are getting your information from reputable sources. Those sources include CDC, which is the Center for Disease Control. They have an array of information out there for businesses and for workers to protect themselves. OSHA also has a wonderful COVID-19 page that is available for workers and employers to understand what they need to provide, what the rights are, and how to actually protect and mitigate risk of this disease at your workplace. So this slide is pretty up to date. I do believe that Kansas City, Missouri has extended their stay-at-home order through May the 15th. And Kansas, as of now, has extended it from the end of the week, I believe, to May the 3rd. So the information is still out, and although the experts are saying that we still don't know a lot about this virus because it's a novel virus. Even policies are still being written at the state and national level. We do know that social distancing is one of the ways that we can prevent the spread of this disease, and that's why the governors are doing what they can, and the medical health departments and state health departments. They're using, from what I understand, a lot of data to support the stay-at-home orders, and so that's where we are right now. I'm going to also talk a little bit about engineering control and inexpensive engineering controls a little bit later in the presentation that will help you as workers return to the workplace to help you minimize the spread of disease. So I am not, I was speaking with a lady on the call a little bit earlier, and we were talking about real estate, commercial real estate. I am not an expert in commercial real estate, but one of the opportunities that I'd like for facility managers to think about as we continue to manage these infectious diseases is, what will this do to prime real estate, and you know, will we ever go back to a state of normalcy where, you know, all of our businesses were occupied, our business offices were occupied? Here's a picture of the new Lowe's hotel. It was a $67 million project. It wasn't able to open because of the social distancing and the issues that surround the COVID-19. So what does that mean for our facilities, and how do we manage buildings that are not occupied? What are our plans? What are the risks? There's increased security risks, there are increased other risks. But, you know, I'd like to encourage facility managers to think through what you're going to do with some of these buildings that will not have the same rate of occupancies that you had prior to COVID-19. So I don't have the answer, but I would like for us to just consider putting that as a priority as you continue to manage and think forward. How are you going to manage these huge buildings? We're still building buildings, and so what are you going to do to manage them? So I'd like to talk about the risk assessment. I would like to assume that everyone has completed their risk assessment. businesses, facility managers have went through their whole business line and everything that they have and completed a risk assessment. So they know what their top 5 to 10 risks are within their building. I would love to believe that and assume that. And this is within your emergency action plan. I would hope that this is within your emergency action plan. I have some lessons learned from a couple of facility directors that I spoke with earlier last week. And one of the facility directors that I spoke with said that they have a really good business continuity department that helps them with their planning and helps them navigate and bring their teams together to discuss their emergency action plan, and that they had 3 levels of preparedness at the beginning. Now, as a result of looking at all of the different risks and all of the different factors that have gone into the COVID-19, they are now up to 9 levels of preparedness. So think about where you are as far as your preparedness and what risk you need to look at. The employers who have not prepared for this pandemic should prepare themselves and their workers far in advance as possible of potentially worsening outbreak conditions. We do know that there will be a second wave of this pandemic. So what will you do then? What are some of the lessons that you've learned that you can carry over to that second phase? So you want to start identifying that, making sure that if there are systems and processes within your risk assessment that you can improve upon, you want to make sure that you do that now, because the worst thing that could happen is you try and do some of this during that second phase. Right now, it's a low time. It's time where I even see businesses doing some preventive maintenance right now that they have put off because they don't have the individuals, the occupants in their building. So they're able to get some of these preventive maintenance tasks off their plate, and now's a good time. So lack of continuity planning can result in a cascade of failures as employers attempt to address challenges of COVID-19 with insufficient resources and workers. When you're thinking about your workers also, part of your risk assessment should include what training do I need to provide for my workers? Have I updated my annual OSHA trainings? Are the trainings developed where the employees can actually put what they've learned into practice, and we do pre and post tests to ensure that they are keeping in line with what the standards are. So the other idea about the risk assessments that I'd like to talk to you about is that make sure that your management team and all of the stakeholders are in the creation of this risk assessment. That includes your facilities, of course, your IT folks, your HR folks, the purchasing finance department. It's important also to bring in your risk management department, because they would have information on trends and resources to help you mitigate some of the risk. I would also include in your risk management process to bring in your marketing and sales team. It is really critical that your communication and your messages around your risk is communicated in a way for all of the stakeholders, whether it's the workers, building occupants, visitors, or whomever. So make sure that you, when you're developing your risk assessment in your business continuity plan, that you include these other stakeholders in there. I would also seek information from your local health department. This COVID-19 has opened up a great opportunity for us to engage with other stakeholders that perhaps we hadn't in the past. Those would be, an example would be your local health department, your vendors. Perhaps you have just a basic contractual relationship with your vendors. Maybe now's the time to really get in and understand what your vendors offer and how you can maximize their offerings. So another lesson learned from another facility manager was make sure that you have plenty of mask and hand sanitizer on hand. We know that right now with supplies very limited, it's really, really critical that we understand the risk that perhaps our vendors have. I talked to one of my suppliers the other day, and he had gotten in a big shipload of masks from, I want to say China or somewhere, but they were no good. He couldn't use them. So being able to understand the vulnerabilities that your vendors have is also critical in this creating your risk assessment. So just wanted to go over the hierarchy of control. There are some controls that we can manage, and then there's some that we can't. And this is actually from the OSHA site. We get this from understanding we want to try and eliminate any physical hazards that an employee has or a hazard that to our asset. So we want to try and eliminate hazards. If we have substitution that we can use to replace a hazard, we want to also do that. Engineering controls are ways that we can isolate people from the hazard, or even isolate our assets within our facilities. So what engineering controls might you want to put in place in order to isolate that hazard? One of the engineering controls that I really like that Hy-Vee has done, I think Hy-Vee is one of the first stores that started this. They put up those plastic barriers. I believe they're calling them the sneeze barriers. And it's really cool. And it's really there. It's an engineering control, and it's there to isolate the people from the hazards. So the hazards for the potential customers that are coming in that may potentially have the COVID-19. And so they want to make sure that they are protecting their workers. So they put up the sneeze controls in order to prevent the hazard from getting on their employees. I saw also at Costco how they have the sneeze controls up, and when they check your receipt on your way out the door, the worker uses a pencil and the eraser to slide your receipt back and forth. And again, these are very inexpensive engineering controls that you can think about putting in, and they work. They help to prevent the spread. So think about engineering controls that you can use within your facility and how you can get those in before the return to work order expires to ensure that you protect your people. Administrative controls or system kinds of controls, how you write your standard operating procedures, your SOPs, making sure that your process improvement is there. And so administrative controls are more process improvement. And then the other controls that we often talk about is the PPE, the personal protective equipment, the goggles, the face shields, the gloves. Those are other controls that we have available to us. Now just switching over to safety management and OSHA compliance. So the workers' safety is critical during an infectious disease outbreak. For the worker, they have the right to go to a workplace that is free of harm and free of being injured. And so that's one of the the opportunities. I have close contacts with OSHA, the OSHA regional director, and many individuals on their staff. And actually the week before this all happened, I had met with the regional director, and we were just kind of talking. I meet with her quarterly just to get updates on some different standards that are coming and just some other workplace practices that I can help my clients maneuver and put into place. And we were talking about silica and some other requirements. But as you know, some of these other standards that are not at the forefront, we have the standards currently that are at the forefront of protecting workers is what we're really concentrating on now. Making sure that your workers are safe, because one of the things you don't want to do is have them out sick for any length of time, because that could definitely impact your staffing. So here is a article that I found as far as what a building or facility had to encounter. And I just kind of want to walk you through this article. So this was a building in Nashville, Tennessee. And I'm sure Nashville is taking a real big hit as far as their tourism is concerned. But I wanted to kind of point out to you, and this is a CBRE building. So after consulting with the health department, the virus will add lots of layers of responsibility to you. You will now, like I said, need to communicate with stakeholders that perhaps you hadn't in the past. So you or your property management company should have conversations with your county health department. And then the communication should be clear, and you should be able to provide information to tenants in the event that they encounter someone that has been positive in the building that perhaps you manage. So as you can see, they posted a note on the outside of the door here in this facility. And this is actually the information that they put on the door. Have you thought about what your process would be, how you're going to monitor situations closely if someone is in your facility and they are exposing other occupants to the disease? Have you thought about that? Have you thought about a plan? So this particular notice says that if it was a woman that was exposed with COVID-19, and she had mild symptoms, and she was able to self-isolate herself at home. The CDC recommends that if an employee is confirmed to have COVID-19, employers should inform fellow employees of their possible exposure to COVID-19 in the workplace, but maintain confidentiality as required by the Americans with Disabilities Act, or the ADA. So employees exposed to a coworker with confirmed COVID-19 should follow up with the CDC guidelines for how to conduct a risk assessment for themselves, and then also contact their doctor. So the note here was really good that they put out, CBRE, closely monitoring the situation. They communicated, and they want to maintain and support a safe work environment. So this is where it would be good to team up with your marketing team to make sure that you have pre-scripted notes and pre-scripted messages, just in case you do have someone that presents with a COVID-19 symptoms and a positive symptom. So the worker training should include your OSHA standards. So your hazardous communication, bloodborne pathogens, any type of worker training on specific cleaning and sanitation would also be good. So being able to correctly don and doff. If you're not familiar with don and doffing, those terms actually come out of the PPE training. When you're done, that's when you're properly putting on your PPE. And when you're doffing, you're correctly taking off your PPE in order to avoid additional exposure to yourself and to others. So when I'm teaching my PPE trainings, I use gloves, and I use actually ketchup, and I get ketchup all over everyone's hands. And I show them how to actually take off their glove in order to avoid getting any of the ketchup on their hands, and then properly disposing of it. That's part of the OSHA standard. One of the other bits of information I'd like to talk to you about the OSHA standards is the key to it is making sure that you document your training. If you have someone that is determined to be exposed at work with COVID-19, and there could be some type of potential OSHA violation or investigation, they're going to want to see your training records. They're going to want to see that you provided training for your staff in order to make sure that they could do everything possible to avoid exposure. They're going to want to make sure that you put in information about how to properly dispose, and that you've communicated the right information to your employees. So make sure that as you are developing your training programs, and right now is a really good time to get your folks trained. I'm working with a couple of clients right now to do some e-learning training and some onboarding training, so when they come back to work, they can actually take these online trainings at home and then just go right into the workplace and be up to speed on the new procedures, the new requirements, and the new standards that employers will have to be adhere to as far as being able to return back to work. So you want to make sure that you get your training up and ready for your employees. Environmental stewardship. Engineering controls is a way to look at ways to cut cost and to implement different strategies in order to protect the environment and protect your assets. So you want to pay attention to your energy costs right now. So a good place to look for savings right now is energy procurement. Demands reduction as a result of working from home. So right now we don't have a lot of people working in the building. So you're able to perhaps save on some energy cost. There will be energy savings that perhaps you can look at to procure with some contracts, and there might be some savings that you can realize. So I would encourage you to have some conversations with your energy providers to see if there's some ways that you can modify or manage your energy right now. Also, you want to crank up the outside air. So there is consistent guidance from the CDC and ASHE and ASHRAE and others increasing about the outside air into your facility is helpful. You will likely experience increased costs and will need to watch your equipment carefully as it may run differently, but this might be a really good way to get some outside air into your facility. Be sure that you have qualified personnel making adjustments and checking your HVAC units more frequently if you choose to modify that. Also, some lessons learned from some other facility managers is to seek advice from the EPA. The EPA has cleaning supplies and cleaning solutions right now. There is a shortage. I don't know about you, but I still can't find some cleaning products on the stores and Walmart or Costco or wherever. I'm still having a hard time finding it. And so are your suppliers. Your suppliers are still having a hard time finding cleaning supplies. One of my largest supplier, who's a huge PPE supplier, they are having a hard time getting cleaning supplies in. There is a new EPA list out that is approved products with varying solutions that you can possibly use. Let's see, I use alcohol a lot, and some other products that were on the EPA list. And so there are some other lists out there. The EPA has some documents that you can use to learn different ways of disinfecting that can help with the COVID-19, prevent the spread of the virus. So here is another important way for you to think about your environmental stewardship, and this is air filters. So I have a colleague that I'm working with, and she provided me with this slide. I'm so grateful to her. And when we were talking about this, she mentioned to me that protection goes up with advanced filtration systems. And so we want to make sure that as you are going back into your workplaces, that you are replacing your filters and that you're getting a higher efficient air filters. If you'd like more information on that, feel free to give me a call and reach out to me. I'm not that versed in this, but I did want to make mention that air filters is a way to also increase or eliminate the spread of disease throughout your buildings. So make sure that you look for ways to find high efficiency filters. Okay, so now I'm down to getting into the boots on the ground kind of information that will help you manage and get your folks working again. The key to the facility running clean and efficient is key actions that the facility director and managers can take now. So as you're planning to reopen, you want to make sure that your internal and external customers, they're going to place so many more demands on you. So making sure that you have the resources and the tools available to meet those demands will be ever so important as we move forward. So how do we move forward? How do some larger organizations do it? So I put this infogram from the Corp of Engineers was very interesting. How is it that the Corp of Engineers was able to mobilize so quickly? So on this slide, you can see, let me see if I can scoot over here. So they have come up with an alternate care facility with 337 beds. They also have been able to award 15 contracts to arenas and healthcare to manage COVID-19 cases or even non-COVID-19 cases. They also have reached out, and they know that college dorms, hotels, and sports arenas are really good places to also provide care for COVID or non-COVID patients. So how can they mobilize so quickly? You know how? Because they had a plan. The Corp of Engineers have taken time to plan. They can actually engineer their activity as little as 5 days and up to as much as 2 weeks. They can convene and make sure that beds are available pretty quickly. They test their plan, they drill their plan, and that is so critical for facility managers as well, is to, once you do your risk assessment, create your plans and test it and drill it. I cannot emphasize that enough. It is so important that we take time to do that. Make sure that as you are developing your plans that you have memorandums of understanding with and other agreements to identify resources and community stakeholders that can help you reach your goals and mission of being able to supply and mitigate risk as they become available. So reopening your building. So I've mentioned this so many different times that right now, with not so much activity in our buildings, some of our buildings are actually closed. Many folks are working from home. Right now is a really good time to update your emergency action plan. It is likely that your facility could possibly engage or have someone that will present that could have the virus. And so creating your emergency action plan now, rather than waiting for that moment and having to scramble or prepare a written plan and educate your site managers and your staff and everybody what to do, that would be a bad time to do it, is in the moment. So now is the time to do it. How will you isolate someone that presents to your building? I've been talking to another colleague. They work at a large government contractor. They have taken steps to arrange their staff that will go up certain stairwells. They'll go up a stairwell in the morning and then they'll come down a stairwell in the morning. And this is all in an effort to keep the social distancing efforts going on even at work. Some companies are actually putting different engineering controls up around folks' desks. A lot of companies are just not going to go back, and they're going to continue to allow their folks to work from home. The other key right now to do, if you've not already done it, is to truly identify your emergency response team. Who are those key leaders within your organization that needs to convene immediately and pretty quickly in order to get decisions made on a issue or an incident? Who are those folks? Get those folks identified. I also recommend testing and drilling your call down drill. Have a call down drill monthly in order to make sure everyone's numbers working correctly. Put a policy or standard operating procedure in place to ensure that everyone knows what the expectation is. We need everyone to call this number within 30 minutes. That needs to be spelled out. They need to call. Well, what number is it they need to call? What do they need to do? They need to wait for instructions. So make sure that your plans and your call down drills are very detailed and that you identify opportunities for improvement along each way. Time them and make sure, did we get everyone called in within 30 minutes? Well, then no, we didn't. Well, next month, what do we need to do to make sure that everyone gets called within 30 minutes? So again, make sure that you identify your emergency response team because they'll need to be activated pretty quickly in the event that someone is in your office and they present with an infectious disease. Want to also coordinate the collaboration with your business partners. We've talked about this before, but I didn't mention your landlord. Make sure that you check with your landlords if you do not own your building, and just make sure what their requirements are. If you need to notify them, if someone on your landlord team needs to be a part of your response team as well. So identify who that person is. Make sure that your employees are properly trained, and we've talked about this a little bit now. Make sure that even now you do the training. If you've not done your annual PPE training, figure out how, and you have new PPE that you've introduced to your facility, make sure that you document that everyone knows how to put it on properly and that you record it and make sure that that information is readily available. Order PPE now for the second wave. One of the things that we haven't talked a lot about, I did some research on the businesses in China and what they were doing to recover. China has a real sophisticated system where they've been checking temperatures They give their residents a QR code. This QR code has information on it on, if they've self-quarantined, if they're well, what their temperature is. So I don't know if we'll go to that. And again, I always do the what if, and more than likely we will do something like that, to where we will need to be able to check the temperatures of those that are coming into our building. So how will you do that? Will you have a scanner? Will you require that employees or residents or visitors their temperature before they even come into your building? So how will that work? Because right now, with no true vaccine, or the vaccine is probably anywhere from, I've heard, 12 to 18 months out, we're going to be living with this for a very long time. So make sure that if you have a way to put some of these other checks and balances in place, that you put those there in order for individuals to be tested. The team building. We want to create high-performing teams, and what better time to create a high-performing team than in a crisis? The crisis sometimes will separate I don't want to say the men from the boys, but the crisis sometimes will separate those that are high performers and those that are not. And so it's going to be so critical that we have high performing teams, because people will have to make decisions on their own. Sometimes they need to know what the decisions are that they can make. So again, this goes back to you being that leader that will implement opportunities for your team to grow and to know what they can do, but it's definitely an opportunity to create high-performing teams. As a facility manager or director, it is a really good time to take personal assessment of your current leadership style. Have you thought about, when's the last time I took a leadership class, or when was the last time I read a book on leadership? This is the time to improve your leadership and to look at ways that you can lead your team down the path of high performance that you want. You don't want to just set the standards. You don't want to just do the standards. What can you do to lead your team to go above and beyond the standards? Invest in worker training. Provide an environment where your employees can feel valued, and that they can give you feedback in order to provide that resource for you. If you have a balanced scorecard, or some other kind of way of measuring, add your COVID-19 response to your balanced scorecard. This is a really good way for you to look back on this year, which is going to be a doozy, but for you to look back, because again, remember, what is measured gets counted. So you want to make sure that this is an opportunity for you to shine with your leaders, because the processes and everything that you implement to keep the facility safe is going to be really critical to the bottom line of your business. So you want to make sure that you find opportunities to shine. So you want to also, when we're talking about coming back to the building and returning, you want to make sure that you tell the truth. Communication is key. In the 1918 pandemic, Spain was able to get the newspaper to report on the pandemic, whereas here in the United States, the information was not very well publicized or reported. As a result, there was a big, huge parade that happened in Philadelphia that the health officials were advising folks not to attend. However, people attended anyway. The parade went on. Within a week, several people were impacted by the disease, contracted it, and actually there were a lot of deaths that occurred. So you want to make sure that as a business and as a facility manager, that you tell the truth about when the COVID has been identified, and just a wide variety of opportunities to tell the truth. You want to review reports and best practices. enhance your cleaning and disinfecting processes. That is going to be critical. Make sure that if you have an outside vendor coming in doing it, ask them what their processes are. Ask them what their quality control and quality assurance is in order to make sure that you are getting the right clean facility. Go behind them and check. Use QR codes to put on a door and see if the room has been cleaned or not. So just use technology as a way of checking and verifying information. You might even want to stagger your work shifts among your facility, your maintenance worker, your housekeepers, in order to minimize the potential risk of exposure to your staff. And then just stay aware of community testing sites, because if someone within your facility has the virus, you want to be able to quickly direct them to someone where they can get testing. So I use technology in my processes, and Property Track is a really good way of being able to use and manage the infectious disease incident. I use here's a screenshot of the actual exposure and then the actual steps that you can take. And then you can also know whether or not the incident has been activated or not. So use your technology in order to bring light and get everyone on board. The great thing about this particular technology is that your other stakeholders can use it and add to it. HR, IT, and just a wide variety of other folks that can have access to communicate, and everyone can be on the same team. So I just would like to leave you with this quote from Colin Powell. We're really in war. We're at a war. We're really in a war right now. Things are really chaotic. It seems like it's going to be challenging getting out of this. There will be second and third waves. But I'd like to just kind of leave you with this. Leadership is solving problems. The day soldiers stop bringing you their problems is the day you have stopped leading them. They have either lost confidence that you can help or conclude that you don't care. So we want to make sure that as facility managers and directors that we continue to provide opportunities for our staff to come, because oftentimes our staff are out doing the day-to-day work. They know how to work more efficiently, and it's up to us to listen to them in order to put those systems and processes in place to make us all look good. Thank you so much for your time. I appreciate being able to share some insight with you around this pandemic. I would encourage you to, again, stay informed, continue to share information with your staff, continue to provide resources to your leaders and your stakeholders in order to combat this disease. Together we can do this. Thank you. Any questions?
Thank you, Janet. Thank you very much. I appreciate it. Let's see, I will filter questions in the chat, and somebody asked, Andrew Tate asked, curious if anyone has looked into UV germicidal lighting in addition to HEPA filters. And that's a question for everyone. And Janet, do you see that as well?
I do. I have a resource for filters, and so feel free. Here's my email and phone number on the slide here. I'd love to have a little bit more detailed conversation just to get the right experts involved in that conversation. So sure, yes, Andrew, please feel free to reach out to me.
Yeah, just in addition to filters is UV germicidal lighting. I've heard about it, but I haven't participated.
Right, so it's very effective, and it's definitely on the increase as far as being able to use it to mitigate risk.
Great. And then I don't see any questions really. Another comment from Andrew. Evergy is a great resource for ideas for energy savings. Managed energy systems is also very effective at finding low-hanging fruit, including rebates, renegotiated rates, quick ROI energy projects, etc. And he posts the website there.
I would agree.
Great. And Daniel said, Daniel Grazinia,
Mhm.
hope I'm saying your name right. My company just ordered 7 cabinets to place equipment or PPE in. They are approximately $800. Thank you, Daniel.
Great, good job. Make sure on your PPE that you continue to look at the expiration dates. That's really important. I was at a facility that was Joint Commission accredited, and we had some expired PPE, and we were dinged on it. So if you have regulatory agencies that mandate that, make sure that you understand what the regulations say as far as storing the PPE. Make sure that it's stored properly. Look on the instructions to ensure that the PPE is stored correctly as well.
Great. Anybody have any other comments, or you want to you have best practices that you're using, or you want to contribute to this conversation while we have you on? You can unmute yourself. Love to hear you. Feel free to do that. Part of this for me is connecting with people. So Adam asked, do you see any legal or employee compliance issues if we're going to force employees and guests to do temperature checks before entering? This will be done by thermal camera.
So I think that one of the issues will be privacy and making sure that we are ADA compliant and HIPAA compliant. And so there's just still a lot of information coming down about this. And so I don't think we know just yet how that's going to play out. I would just encourage us to continue to look at those resources from CDC as well as OSHA. OSHA, I'm sure, will make some standards around that.
Mm-hmm. Great.
And check with your HR department as well.
Mm-hmm. Great. Becky Belhar says FEMA website ready.gov has preparedness info as well. Carl says we are moving a lot of equipment, copiers, printers to workers' homes. If we can help reduce short-term rentals, he leaves his information there. We have a couple others who are HVAC providers, Haley and Samantha. And I also want to remind everyone on this call that next week we'll be hosting a roundtable next week to discuss what we learned today and also discuss ideas for implementation in our facilities. If anyone has plans in place or in progress that would be willing to share for next week, that would be great. Our email is info@ifmaKC.com. .org. I'm posting it on the site here. And also, yes, Becky also says CDC also has. Rose says, send them our way, info@ifmaKC.org. Great. Well, I really hope that this provided some value for you today, and Andrew posted another good website with other info.
Hey,
Great.
Amy,
Yes.
it's Becky. I see the question about legal or employee compliance issues if they are going to force the question was if we are going to force employees and guests to do a temperature checks before entering, make it optional. but then they can't come in if they're not willing to take a temperature. That's what the government's doing.
Okay.
We ask, may I take your temperature? Oh gosh, sorry, there were two questions. How are you feeling today, and may I take your temperature? And if they say no, we turn them away.
Okay.
We're 100 or 99% teleworking. We've got a couple of people in the building, but we gave them that option. You do not, if they register 100.4 or above, you just tell them to talk to their supervisor. If they're below, you just kind of say, have a nice day. You don't record any of that information for PII purposes. You don't tell everybody else. We made a little area so that could be done in private as they were coming in the door. We ended up not doing that for much more of a day or so. And then we had so few, when we had people in the building, we only would have about 30 people in the building. We happened to have a nurse from HHS, Human and Health Services, in the building, and he would just walk up to you and say, may I take your temperature? So it was easy enough with that few people, it was easy enough to track who, now, not that he had a checklist, but he just knew who was kind of in the building every day and would walk up and ask them. But if we were going to have a lot of people coming into the building, at our entrance, we kind of had a segregated area where you could walk behind some panels, and we just used some promotional panel, screens that headquarters had sent us. And so you could kind of walk behind there, they would take that temperature and walk away. But we also treat it as your adults. If you're not feeling well, if you think you have a temperature, just don't come in. So I think your company balance, how important is it that your people are in the office, and are you going to continue some sort of telework? And if you don't, determine what you're going to do for that. But we made it an option, but if they didn't take the option, they were sent home.
Excellent, Becky. That's really helpful. Yeah, it's an option, and yet if they don't do it, then it's not like they're being forced to or required to. It's just, that's just the procedure.
It may depend on their job. If their job is, if their job is building based, then it might be a requirement, and then you have to determine how you're going to do that. But if it's not, we're all learning what jobs are and what parts of our jobs are building based and what can be teleworked. So
right.
I just kind of wanted to share that perspective from what we're doing. And those of you that don't know my voice, I'm Becky Beilharz, and I do work at FEMA here in the region.
Thank
Great
you,
information.
Becky. And I just want to give you another Zoom tip. If you want to save your chat, there's a little, in the chat feature, there's 3 little dots. And if you click on that, you can save chat, and it will save the chat to your computer. And you can open it if that's something that you need. You can do that. I'm learning new things about Zoom and online conferences all the time. So I hope if you have any tips, let me know. If this was valuable for you, if you have any ideas for us moving forward, we would love to hear from you. How was this meeting for you? And Janet, thank you again so much for championing facility management and health and safety, and thank you so much for being our presenter today.
Thank you, I appreciate it.
Of course. Well, I don't see any more questions, and I hope that you all have a wonderful day. So wonderful. Okay, so we're gonna go ahead, and people are saying thank you. Wonderful. Okay. All right, Rose, I think that is all.
Okay, everybody have a great, wonderful day.
Thanks, Rose. Thank you, everybody. Bye.
Bye-bye.